Hello, and welcome to today's show of Plymouth Public Health Matters. I'm Dr. Nate Horwitz-Willis, the Town of Plymouth's Director of Public Health, and today we're going to be discussing marijuana education within the town of Plymouth and also in the surrounding areas. And on our show, we have a noted neuroscientist and public health advocate, Dr. Amy Turncliff. Dr. Turncliff, thank you so much for joining us today.
Thank you for having me.
Hey, anytime. And as I know, you've done a lot of work around Massachusetts in the area of substance use and also neuroscience, or how the brain works. And there's a big connection between public health and neuroscience. Mm-hmm. And when we start to talk about substance use, we've talked about opioid use around the town a lot. And then now an emerging topic is marijuana use. And I understand in your line of work, you've done so much to help educate the public. And as more and more sciences emerge, mm-hmm. you are educating the public more and more again. Yeah. So, if you could just tell our viewers some of the work that you've done in this arena already and why this matters, why we need to educate about marijuana use and also with the public's health.
Sure. So I think there's a big disconnect mm-hmm. between how the public and probably even regulators and policymakers perceive the marijuana of today as opposed to what it actually is. So more recently, instead of saying marijuana, right. I've heard some clinicians and scientists suggest we start calling it commercial THC, because the psychoactive component of marijuana, as you probably know, right. delta-9 THC, or delta-9 tetrahydrocannabinol, is the portion of marijuana that is responsible for the high and what we say the psychoactive part. And really, many of the products that are sold in terms of the commercial market are in fact THC and high THC. So. I think there is a large disconnect in understanding of the effects of what used to be considered marijuana decades ago and what is marijuana or marijuana-related products right. today.
So when you say the marijuana of today versus decades ago, what exactly does that mean for someone who may say, well, hey, this is going to be regulated now and I can go in and I can buy this product and I can feel safe about it and it's off the streets, so we're going to be fine. So what does that really mean?
So it's an interesting question, and I think in an ideal world, if specifically products were only being sold in stores mm-hmm. and not on the black market, and they were highly regulated and with a lot of very close monitoring, including testing for pesticides and contaminants such as fungus and mold, in addition to ensuring that youth weren't getting them. I mean, I'll come back to that.
Right.
I can see that argument. I can say that we in Massachusetts and no legal state is following a public health framework for regulation. Mm-hmm. And when you don't follow a public health framework, we know based on public health history what winds up happening. And right. oftentimes you have increased access by youth. There's a reduction in the perception of harm by right. youth. They start to think it's okay. There's a what we talk about a social normalization or a cultural normalization, where they start to see more adults using a substance, which then again decreases the perception of disapproval of use for them.
Right.
So there are unintended consequences that can happen when we do have legal substances that have addiction potential.
Right. So essentially, without that public health framework, we're not really thinking about those unintended consequences. Mm-hmm. And those unintended consequences could be short-term or long-term health impacts.
That's right.
And from my own experience, I do know through the Councils on Education of Public Health, and then also through American Public Health Association, and even through our own Massachusetts Public Health Association, there's been talk about understanding these both long-term and short-term health impacts. Now, we'll ask you again about some of those things from the standpoint of psychosis. So when we talk about psychosis and getting that high from the THC, what have you seen in regards to the development of the brain and also other health impacts associated with that when you do have that psychosis?
Okay. So the brain isn't fully, now neuroscientists know or think that the brain isn't fully developed until at least around 25, the age of 25, right? So there's a few things. So we know that the younger someone starts using impacts their outcomes,
Right.
and specifically related probably to mental health outcomes as well. So there's age of first use. There is what they're using. So are they using what might be low potency, we call low potency marijuana product, so low THC content. So low used to be considered about 2 to 3%. Now low is, I think, considered generally anything under 10% THC. And so the effects, the kind of the health effects or the impacts on the brain are more, I don't want to say more concerning, but more salient for those under the age of 25 when the brain is still developing. When you talk about psychosis, so not everyone will experience the effects of THC use as a hallucinogen, right? Not everyone is going to hallucinate when they use THC. I think what the research is showing is that the use of high THC products does bring increased risk of what we might call cannabis-induced psychosis, is the clinical diagnosis code for that. So high THC, and so the potency is related to that, and frequency of use. So someone with a diagnosable cannabis use disorder, it looks like which means they're using it very often, also increases the risk of experiencing what we might say psychosis symptoms, so cannabis-induced psychosis. So there's that piece, which is the short-term effects. What's also in the literature and what's being talked about is the long-term risks of serious mental health issues, mental illness. Specifically, the question has been posed, is someone who experiences cannabis-induced psychosis around the time that they're using, then more likely to develop long-term psychotic disorders, chronic psychotic disorders like schizophrenia?
Oh, okay then. So when we talk about those psychotic disorders, in your review of the literature, have you seen that in the very young or either the very old, or is it just a toss-up, or do we not know?
Now, there does appear to be an increased risk of first episode psychosis, which is psychosis that is occurring in the absence of acute substance use, right? They may still be using a substance, but the diagnosis of first episode psychosis would be distinct from something that was being induced by the substance acutely. So that's distinct from cannabis-induced psychosis. Okay, so there has been shown in the scientific literature, actually a study just was released in March, and this was done in Europe, showing that there is an increased risk of first episode psychosis in those who use marijuana, specifically high THC products and high THC products frequently. But increased risk with use, and then that risk increases with increased use.
So there is no age cutoff?
Well, so it's a good question.
Yep.
And I think the answer to that is we don't know.
Right.
Certainly, generally, schizophrenia, psychotic disorders are generally diagnosed around the late teens, early 20s, kind of maybe pushing into the later 20s.
Right.
Generally, that's just across the population.
Okay, because from my review of the literature, talking about health impacts from a cardiovascular standpoint, I know that exists, in which individuals who may not understand their own health conditions, if they consume a certain amount, and not just the concentration, but an amount of THC, they may then have things such as a heart attack, embolism, or even stroke out because of that psychosis. So I'm beginning to wonder if our adolescent population is even thinking about this, because the evidence now is even trending to suggest that you're starting to see more younger people have things such as type 2 diabetes, atherosclerosis, and heart attacks. And do you think that we could start to see the use of marijuana contraindicated with these types of events? Is that what you're starting to see within literature, possibly?
I mean, I would say marijuana use is contraindicated for people under 25, based on the literature, I would say. I think it's not clear whether or not the cardiac effects of marijuana, which I think are being seen in emergency departments across the country, across age groups, so including young, kind of the younger population, but also in the older, in the elderly population, and middle-aged, and on and on. I think it's not clear whether those effects are related to the psychosis, the acute psychosis symptoms, and that's causing anxiety and stress, or including stress on the heart. But THC also does impact the cardiovascular system specifically. So I think we can't distinguish between those two. I would certainly say anyone with a heart condition that, yes, using THC probably is not a great idea because of the impact on blood pressure and the cardiovascular system.
Well, that is very good sound advice, because when we talk about these things, there really is the current landscape of the policy environment is starting to kind of morph a little bit. And I want to ask you, what is your opinion on the current health policy landscape in regards to what the Cannabis Commission has done? What do you think of when you use your neuroscientist background and then you look at what they've written? Do you think they've gone far enough? Are there some areas in which they should try to address? What are your general thoughts?
Yeah, so I don't think they've gone far enough. I do think that they would like to, to have public health and safety in mind. However, I certainly can say they're not using a public health framework in their, setting the regulations. I absolutely will say that they have, and probably, or may, hopefully, can put in place some elements of a public health framework, but it's certainly in no way comprehensive.
Right. So that opportunity does exist for them to incorporate and even implement a public health framework. And I know we have plenty, programs in schools of public health. We have public health advocates such as yourself. Maybe they will consult with you. Who knows? But aside from that, though, do you have any recommendations for any municipalities to consider, to incorporate that public health framework that you're talking about?
Yeah. So one of the big areas for me, based in the neuroscience, is potency limits. And we don't, as a state, have potency limits. We do know that potency matters, so the amount of THC in product does matter. And the other one is certainly ensuring that youth aren't gaining access to product that we already know that they are. So putting in place, particular measures to reduce that likelihood.
Those are excellent recommendations that you're offering right there, and perhaps some municipalities will take the lead on that.
Opiates has taken everything and everyone I've ever loved away from me. Everything.
I blew my ankle out and I got prescribed pain pills by my doctor.
If making my detox public is gonna help somebody, I'm all for it. I just wish I would have had a warning.
Opioid dependence can happen after just 5 days. Know the truth, spread the truth.
And welcome back, everyone, to Plymouth Public Health Matters. I'm Dr. Nate Horwitz-Willis, the town of Plymouth's Director of Public Health. And then on our show today, we're talking about marijuana education in the town of Plymouth and other surrounding towns. And with us today, again, is Dr. Amy Turncliff. And then just to kind of let everyone know here where we're at, we just wrapped up talking about the Cannabis Commission and their health policies and incorporating a public health framework and talking about both short-term and long-term health impacts. And, continuing on, what I want to discuss is a recent article that was published in the Boston Globe in which they talked about using marijuana laws to stem or even stop the opioid addiction. And I know that there's some controversy around that, and you yourself have been looking at some of the literature. What is your opinion on trying to use marijuana law to try to curb the tide of the opioid epidemic, and how is this even related to it?
So the study that you just mentioned is an update, a replication and an update to an older study that was done. And that older study looked at medical marijuana laws, so the states that had medical marijuana laws, and looked at opioid overdose rates, essentially, and said, well, the states that have medical marijuana laws looks like they have fewer opioid overdoses. So it turns out that finding was likely to be an ecological fallacy, which was the states that had medical marijuana law, so medical marijuana laws first were out to the west of the United States, whereas the opioid epidemic started in the east. So probably those two that finding had nothing to do with medical marijuana laws, and just was a kind of a symptom of the trend in which opioid use moved across the country.
Right, and I think it's important for viewers to understand that when you look at that relationship, we say that's correlation or correlation when you use it so much, right? And correlation does not imply causation. And in this case, when I was reviewing and reading this article, I just thought to myself, wow, you see it oftentimes in a lot of municipalities around the country or even the globe, in which you take something that is ecologically flawed and you think one size fits all. And when you're looking at that study and even reading the article, one of the authors of the study had found out that their results were taken and used to incorporate laws in other surrounding states. But now I will ask you, a little bit more about using our own existing framework. Do you think, or have you seen any municipalities around the state try to use this framework to curb the tide of the opioid epidemic?
I have not. I have not personally. I have heard about it, and oftentimes I think it's used in discussions and in arguments for why a municipality or more often a business should come into a community. And they'll say, oh, well, it will help with the opioid epidemic. Well, this study that you just mentioned that was published, I believe, it was published this week, and it may have even been yesterday, in a scientific journal, that replicated those previous findings, or tried to replicate, so using the same methodology, but also extending the time frame to include additional medical marijuana states, so states that had legalized medical marijuana, and they in fact found more opioid overdoses in states with medical marijuana laws. So they found actually the opposite effect, I should say correlation, right, or association there. So, I think no one knows, and I think the authors were even stating, we don't know if these findings have anything, causally to do with each other.
To say that is a direct cause because of that. Now, I will ask you, back previously when we talked about setting the potency limits. Now, have any municipalities around the country looked at potency limits and even tried to make that relationship with opioid addiction? I mean, has that even been done?
So there's a couple of questions there. One is, have any municipalities tried to limit potency? I am not aware of potency limits in the United States. Other countries that have I don't want to say loosened, but loosened their marijuana laws, including the Netherlands, kind of Portugal, states, so those countries do include a conversation about potency and what is a hard drug
Right.
and what is not
Oh, okay.
in the language of their law. In the United States, we don't. It's kind of a free-for-all, and unfortunately, the product can be more than 90% THC.
So we do have an opportunity to talk about setting potency limits. I mean, to at least talk about, have that
Yeah,
conversation.
absolutely.
Because I'm not sure if you can recall, though, that there was a delegation from the state that did travel to Portugal, and it wasn't really stated if they had this conversation. However, was there any kind of findings from any municipalities, or did you see any municipalities start to even have this dialogue, or have you engaged in a dialogue with municipalities yet?
I have not. I mean, I'm always talking. I and other clinicians, if you know me,
Yeah.
Clinicians and scientists are always having this conversation because based in the science, I'm all about science-informed policy.
Right.
That is my motto. So I think based on the science, we certainly need to be looking at potency limits. Not only looking at potency limits, but sharing information, factual information, with the public at large,
Right.
so they can make educated decisions. For example, Canada has, while I don't believe they have potency limits, one of their warnings is about psychosis. And it says, their warning label will read, and I think they have it's based on tobacco, so they will cycle through warnings, maybe on 50 or 70% of the package. And one of them is a warning about cannabis-induced psychosis and
Right.
increased risk of schizophrenia.
Right.
So that's based in science. And I feel like here in Massachusetts, there really isn't much conversation happening about these very serious mental health risks. Not only the mental health risks, but even for our children,
Right.
for the adolescents. We know that youth use is probably likely to increase
Right.
after legalization, and having honest conversations about the impact on the adolescent brain and cognitive impairment and increased risk of addiction. And the second part of what you had asked me was about whether there was an increased risk of addiction with the higher THC products. And really, I don't feel like there's been a lot of good new data on that.
Right.
I think it's assumed that the answer to that is yes, there will be an increased risk of addiction. But we don't know yet exactly what that is. For youth, we know that about 1 in 6 who use will become addicted, become dependent, and about 25 to 50% of heavy users, heavy dealer teen
Now,
users.
is that information from a national study that was
Yeah,
conducted?
that's nationally.
Okay, then.
And that's the information that the National Institute on Drug Abuse puts out. But I do believe that there was something recently that said about 30% of teen users using the newer marijuana of today.
Right.
1 in 3, sorry.
Wow. Now, so that came from NIDA, is what we call the National
Yeah.
Institute of Drug Abuse. So was that also from the University of Ole Miss that contributed that information?
Yeah, right. That's where the lower potency,
Right.
marijuana of,
Right,
it is
and so with that being said, we do have other entities who are trying to study, because we do know Harvard and MIT were awarded some funds to engage in a new study that will yield new results of understanding this. And that brings me to your work with the Massachusetts Prevention Alliance. And one of the key critical areas that you've been looking at is looking at marijuana policy in Massachusetts. And you recently published a statement of concern. And you've kind of talked a little bit about that in various ways a little bit earlier on, but can you help to educate us about this statement of concern?
So the statement of so I did coordinate the statement of concern based as Chief Scientific Advisor to the Massachusetts Prevention Alliance, largely because I do attend a lot of meetings,
Right.
And sitting in on meetings where, scientists, clinicians, pediatricians, addiction and mental health clinicians, we're all having conversations among ourselves about what we're seeing in the literature, what they are seeing in the clinic, even with young people, pediatricians in particular, and expressing very significant concerns. But that information tends to stay, within the folks who are talking to
Right.
themselves,
Right.
and not making it out to regulators, policymakers, public at large. I can say I and some other clinicians have been providing public testimony to the Cannabis Control Commission, to legislators, for many years. So
Right.
this is not the first they are hearing of it, but I think many of us felt like there needed to be a stronger voice. There needed to be an advocacy voice for the science,
Right.
and a way to share that in a constructive way. And so I think we do feel like this was a constructive way to share that information, instead of getting it out in pieces and individually, to kind of have a collective and cohesive statement based in science and based on what clinicians are seeing.
Now, where can people find this statement of concern? What's the easiest avenue for people who are interested in understanding what you're talking about? How can they get a hold of it?
So the statement of concern is posted on the Massachusetts Prevention Alliance website, and I think that's at www.mapreventionalliance.org. And then there is a link to the statement of concern. I think there was a press release on that website. And we do continue to have clinicians asking to sign on to
Right.
it. I think they find value, and I think the sense that I get is that they have been concerned about this too, and are happy to have an avenue to be able to share that concern.
Right. And you mentioned earlier also about the informed consumer, and I think it's very wise, and it's also good for people to understand that we're not here to tell people don't use marijuana. However, for those who are under the age of 25, the likelihood of your brain not developing appropriately exists because you're consuming so much marijuana, and depending on the concentration or the potency, that may have some negative health impacts for you, in addition to the people who may have health conditions that they may not know about.
That's right.
Is that a fair thing to say?
Yes, that is certainly fair. And I think we still don't know whether people who are beyond 25 are at risk of, kind of the cannabis-induced psychosis, let's say.
Right.
But it absolutely is fair. And you should know that that THC does interact with our natural neurotransmitter system, so the brain. And that system is very important in brain development. So using marijuana, in adolescence and young adulthood, even through the college years, it really does bring significant risk.
Now, let me ask you here real quick before we wrap it up, what about vaping and using marijuana, or vaping and using multiple substances? And then, not to mention the different types of vaping, when you have different types of metals, associated with that. What have you been finding? What have you seen in your current work?
So the nicotine itself is highly addictive, right? So there's that issue, and you're training young people who are using nicotine,
Right.
especially during using the vape devices, are training their brain that they need that.
Okay.
And then yes, we are seeing an increase in the use of marijuana products, including high THC oils in vape devices, and that is certainly alarming given the concentration of THC in that vapor, and the potential impacts for the adolescent brain.
Wow, so the potential exists for a vape to be sold with the marijuana, and people may not even be aware of it, depending on how that package is branded or labeled.
Right.
Wow, so there remains a lot of work to be done, and that means that we have so much work to do on the public health side and with our public health advocates and also policymakers and decision makers. Dr. Turncliff, it's been an honor to have you on this show. We could talk for days about this because we need to have that discussion, as you alluded to, and I'm hopeful that this educational segment has been able to do that.
So thank you.
Thank you, and thank you all viewers for tuning in to today's Plymouth Public Health Matters, and we wish you a wonderful day. This is Dr. Nate Horwitz-Willis. Take care and have a good one.